Good morning. We're here at the Canadian Centre for Men and Families, the headquarters of the Canadian Association for Equality, a charity focused on the health and well-being of boys, men, fathers, and families. We're here today to commemorate the National Workers Day of Mourning. The National Day of Mourning was started in Canada and it is now observed around the world. We mark April 28th each year as the day we remember every worker who has passed away or been seriously injured at or because of their work. We know that these tragedies affect more than just the individual, but their families and friends as well. The number of reported workplace deaths stays stagnant at around 1,000 Canadians each year. That is almost 3 people each day. The actual numbers are far greater, however, as the given figure only includes reported and accepted claims. There are a vast number of additional fatalities connected to an individual's work, death from asbestos poisoning, for example, which are not included in the yearly figures. The number of serious life-altering injuries far exceeds the number of deaths, and that includes a large number of Canadians under the age of 25. We at the Canadian Centre for Men and Families will be taking a moment of silence today, April 28th, to remember all those lost and affected. As we reflect on the tragedies, we rededicate ourselves to the work we do as advocates on many levels. This year, during the global pandemic, we will also be thinking of all of the Canadians working to get us through this very challenging time. In particular, we acknowledge and thank frontline healthcare and related workers, and we call for the strongest possible measures to safeguard the health and welfare of these heroes. One workplace fatality is one too many, but to solve this tragedy, we need to acknowledge and respond appropriately to those affected groups. And the fact is that males account for the overwhelming majority of deaths on the job. In the period from 2005 to 2015, males were 96.5% of workplace fatalities from workplace disease and 91% of workplace fatalities from workplace trauma. The most dangerous occupations, construction, manufacturing, and transportation among them, employ a significant proportion of male workers. Now, we're a men's health organization, so we challenge men to move away from an identity tied to behavior that is risky or dangerous, and we encourage men and women to demand a safer work environment for themselves and their coworkers. Thank you very much for your attention and participation today. We are very pleased to join with the many other organizations participating in the Workers' Day of Mourning on April 28th. Please take a moment today to remember those Canadians, their friends, and most importantly, their families, which have been forever changed. Stay safe, be kind to others, and be kind to yourself. Thank you.